Hello, my name is Amy Sturkey. I am a pediatric physical therapist. I'm here with Jack, and Jack just turned 13 years old. Yes, and Jack has severe involvement physically due to cerebral palsy. So he's a gross motor function classification system level 5. And Jack's just been diagnosed recently with a 65-degree scoliosis, which has been a long time coming. He's gonna have to have scoliosis surgery in the next couple of weeks. So I thought we'd talk about the things that people wish they knew before surgery. One of the things that parents say is they think that this is going to be a 1 or 2 week event, and then things will return back to normal. Well, you are 5 to 10 days in the hospital with this surgery, but really it is a 6 to 12 week significant recovery thing. It takes functionally an adjustment of about 1 to 2 months, because so many things change. I mean, if you think about it, his mom has been working with him for 13 years, and through this time she's learned how to work with Jack. But Jack is about to have a much more upright spine, according to how low they go on with the rod surgery, and it's not going to be flexible. So she's going to have to learn new ways to work with him. It takes time to learn how to transition him now after the surgery, and it can take a while for him to learn to tolerate sitting well again, and fatigue after surgery can last for months. So we talked about that after surgery, that according to how low they go with the rods, and I'm imagining they're going to go full back with him with the rods, that parents are often surprised how much straighter they are. In fact, he could be 1 to 2 inches taller, and sometimes I've seen even more. It tends to get about a 60 to 70% improvement in the side-to-side correction of the curve, and about a 50% correction in 53 correction in the rotation of the spine. So that means really all his equipment is going to have to be modified and changed. And for his mom, she's going to have to relearn how to dress him, how to change his diapers, how to transfer him, how to help him bathe, all those things. It's not going to be the same kid anymore. And the other thing that parents worry a lot about is pain levels. Even when pain management is done very well, kids are uncomfortable that first week, but there tends to be a steady improvement over time, and they tend to return to their baseline. So it's important to know that, for example, in the wheelchair, he's going to be taller in this wheelchair, so the back is going to have to be higher, the laterals are going to have to be higher, the headrest is going to have to be higher, and all of his equipment is going to have to be changed to be able to accommodate the new Jack. The other thing we have to talk about is stress, because families are stressed. This is no small thing, the center of your body, the spine. This is a big deal. So they worry about just what's going to happen, what are the complications, and when you're at the hospital, that's a very stressful time. But the research says is that when parents come home and they see the difference in the child's positioning and comfort and ability to breathe, that parents on the great percentage are very happy that they've done the surgery. What they see is a quality of life improvement after scoliosis surgery. They see an improvement in sitting balance. They see that they're more comfortable, that the positioning is better, the ease of care is better, and hopefully it'll be easier for Jack to breathe as well. What parents say often in these kind of studies is they were glad they talked to another parent who'd had that surgery. They are glad that they've taken time off of work or arranged to have extra care at home. And they're glad that they prepared their house beforehand before the surgery. What parents say significantly and frequently when they ask in post surveys is they wish they had known that severe CP almost always ends up with a progressive scoliosis. Really 70 to 90% of people similar to Jack, they end up with a progressive scoliosis, and there's really not a lot you can do to prevent that from happening. And they say that if they had known that that was probably in their future, that they would have been a little bit better emotionally prepared for this when this day happened. I am going to be keeping tabs with Jack. If you have ideas of things that you wish you had known about scoliosis surgery and you've been through this, or if this was helpful for you, please leave a comment and I will relay any of these suggestions onto his parents. I hope this is helpful for you and we'll look forward to seeing you next time. Thanks a lot. Bye-bye. If you liked this video and would like to be notified by email when the next video comes out, click the subscribe button here and click the golden bell icon and ensure notifications are enabled on your account.